Now how it's everything is loop. Have you noticed?
Yep.
Loop, 1, 2, under, up, all looped. Okay?
Right.
So now, 1, 2, and I go down. Now look what happens. When I push this, see how it pushed it down? Pushed it in, and that will prevent my herniation. Has nothing to do with the migration.
Right.
That will prevent my herniation. Okay? Okay? So now I locked it. Okay, now, secondary positioning is now, we make sure that he will take an x-ray, and my position is good.
Right.
Exactly, because
If
now
not,
when
we
I,
can,
because remember, when I push in, this might push in as well.
Right.
So I pull it out a little bit, that's my secondary positioning. Now I take my stylet out.
Right.
Okay?
And then
Now,
lock it.
once I take it out of stylet, now what I do, I just have to go behind it. I have to get this, and I go behind, under, I go usually under the, under it, and go behind it. Okay? Now, why? Because now that's going to be my first squeezing suture. Remember we talked about squeezing suture? That's 1, that's 2, and look what happens now. See how it squeezed it?
Right, it clamps
And
it
that's
down.
exactly what you want.
So once you confirm that it has not moved, then you start clamping it down.
Exactly. And now I clamped it down. Okay? So now I go behind it. Here. And what I do everything all over again. 1, 2. I go in on my other squeezing suture. And I go in.
A couple minutes on top.
Exactly. And I go back again. And I do it all over again.
How
1.
many times do you go back and forth roughly?
Until it's done.
Until you don't have any more strain.
Then until half. Okay, see? So now look at this, how many squeezing we have. See? It's beautiful squeezing. Because that would help you keep it in place. Now we go back in again. Okay? See that? Look how beautiful the squeeze is? You really hold it in place. Okay?
So you don't use the other eyelet on
No,
this one?
I don't use the other hand. 1, 2, 3. Now I go again. Okay, here it is. Look at that. See how the squeeze? See how many squeeze we got? 1, 2, and 3. And now I use the Chinese way. Okay.
So once you're past the
Once I pass the anchor,
you start
I go
using
with the
this
lead.
more of a
I
braid.
start using the lead.
But you have only a single contact suture with the body.
That's it. Because I'm going to put a lot of tape, and even if this, which is usually never cut off, but okay. So now, if you want to pull on this lead, you can see it's really tight. So correct?
Yep.
It's really
It's
tight.
not going
It's not
anywhere.
really. So and that's what that's all what you want.
Okay.
You know, that's what give you at least for a week or so.